How risky are adenomatous polyps found during sigmoidoscopy? Imagine discovering a tiny growth in your colon during a routine test. That's what happens when adenomatous polyps are found during a sigmoidoscopy. These growths are important because they can be precursors to colorectal cancer, but their risk level varies quite a bit. Adenomatous polyps are classified based on their size and tissue features. Small polyps, usually less than 10 millimeters, are common and tend to have a low chance of turning into cancer. Studies show that in low-risk patients, the chance of finding more advanced or larger polyps in the rest of the colon after detecting small distal polyps is very low, often between 0 and 4%. This means that if a small adenoma is found during sigmoidoscopy, it generally indicates a low immediate risk for cancer. However, when polyps are larger than 10 millimeters, or if they have villous features or high-grade dysplasia, the risk increases. Polyps bigger than 2 centimeters have about a 50% chance of becoming cancerous over time. Villous adenomas and those with high-grade dysplasia are also linked to a higher chance of developing cancer, especially if they are found in the distal colon. Patient factors play a role too. For example, a family history of colorectal cancer, smoking, obesity, and certain genetic factors can make adenomatous polyps more likely to progress. Smoking doubles the risk and is often associated with larger, more advanced polyps. It's important to remember that sigmoidoscopy only examines the lower part of the colon, so it might miss polyps higher up in the colon. Still, the presence of small adenomas in the distal colon usually suggests a low risk of significant disease elsewhere, especially in people without other risk factors. When adenomatous polyps are found, the next steps typically involve removing them during the procedure and planning follow-up screenings. For those with 1 or 2 small tubular adenomas, a repeat colonoscopy in 5 to 10 years is usually recommended. If the polyps are larger, have villous features, or there are multiple adenomas, more frequent surveillance every 3 years might be advised. In summary, adenomatous polyps found during sigmoidoscopy are a warning sign but not an immediate danger in most cases. Small polyps in low-risk individuals tend to have a low chance of becoming cancerous, but larger or high-grade polyps requiring closer monitoring. Regular screening and appropriate follow-up are key to preventing colorectal cancer and maintaining colon health. Always consult your healthcare provider for personalized advice tailored to your specific risk factors and health history.